Thank you for calling BJC Infusion. This is Cheryl. How may I help you?
My name is Cheryl. I'm a pharmacist for BJC Home Infusion.
Okay. Yeah, we've got a delivery coming out to you today.
I worked for another home infusion company that was a for-profit company and decided that maybe a change would be in order. And I interviewed at BJC Home Infusion. I've been there for about 2 years and found that it's really a good fit for me. I really like the fact that we are very patient focused, and I frequently hear the phrase, we need to do what's best for the patient.
Yes.
Have you been able to tell the difference in how you're feeling after the treatment?
I can tell the difference, yes.
And your blood pressure staying normal?
Yes.
That's really great.
People that are in the hospital, although sometimes they come from home also, they need therapy that is maybe not available or not as effective by mouth. And so what we do is they'll have some sort of an IV line in them, and we provide medications for them through the IV line. I think I have the best job in pharmacy because I get to have patient interaction, I am able to use my clinical skills, and then I'm able to develop relationships with doctors, nurses in the doctor's office, and I feel like I really can impact the outcome of a patient's therapy. Every pharmacist has their own kind of specialty group of patients that they take care of. So one pharmacist might be taking care of hospice patients as well as the heart patients. We have a couple pharmacists that take care of chemotherapy. We have one pharmacist that mainly focuses on the antibiotics and the people that have infections, and then we have 2 people that work on people that have need for IV feedings, and then I also do the pediatric population.
And then on that one, you need more saline, 4 more saline hundreds.
I help coordinate the patient's care. We get the orders from the physician.
This one.
There's a lot of checks and balances all the way through the system. First of all, making sure you've got the right medication. We'll double check, our orders against what we've entered into the computer, and then when we go back to the laboratory area, another pharmacist does a final check, making sure that not just the product is correct, but the label directions are correct, the quantity, how it's been mixed is correct, and then putting that together with the supplies to make sure that the patient has everything they need in the home. We decide how to administer the medication, whether it needs a pump or not. And then once a patient is on service with us, we follow up. We want to make sure that we're staying on top of anything that's going on with a patient. We do have nurses that go into the home to teach the patient or caregiver how to infuse the therapy, and we also have drivers who make the deliveries to the patient's homes. We get our referrals from a lot of different sources. Probably the main source is people that are in the hospital and they're going to be going home. They're sick enough that they need IV medication, but they're not so sick that they need to stay in the hospital. So that's one source. Another source would be directly from doctor's offices. We have had patients actually call us looking for a home infusion company and self-referring, and then we can contact their insurance, make sure that we're an approved provider for the patient's insurance, and also then contact the physician's office to see about getting orders for that particular patient. I would positively recommend home care for a pharmacy students, and I do. I talk to our pharmacy students, the ones that are not already tied into going into retail, there's a lot of those, but we do get students through there who haven't decided what they want to do. And I always push home care. I think it's the best job in pharmacy. I really do.